So here we are, accurate as possible. So 47-degree lordosis, not bad. That's pretty much our angle here. And I'm gonna use this right here, because this I'm gonna use the bottom of L3 compared to the top, because it's kind of beat up here. You can see this pretty well. 47-degree lordosis, not bad. But in spite of that, still here. Now, this patient does not have the problem with the flatback that I've shown in the past, where there was not attention, or they didn't know at the time about keeping lordosis, and it was they'd have a flatback and then push the patient over. So in spite of having a good lordosis, still blew out the L2-3. But, still has lordosis, that's good news, and the muscle still is good. So that's a bit of an advancement compared to, 2000. So this is our pre-op spins. These are cortical screws. So instead of coming out here and going this way, it allowed for a smaller incision and shoot the screws in, but they'd also have to shoot cephalad or towards the head, more doctor talk. So they're going this way instead of going right down the pedicle and shoot up and shoot up. So that made for a smaller incision. They're pretty strong screws. So the problem here is now it's a little different trajectory. So we're gonna have to cut the rod here. And our trajectory now is going to be different, even though it's minimally invasive. So we'll probably have to take this screw out and reimplant it at a little bit different angle. All right, we're all done. Here's our cage, laminectomy. Now, for L2-3, you got to, the nerve roots are very close. They come out more perpendicular. So you have to go in the Camden's triangle a bit, so they stay a little more lateral. So the cage is in good position. We got lordosis on it. It's the screws in 3. Remember, the other screws came in from this direction, so we had to cut the rod, take the old screws out, and put new screws in out here. So those are the screws in 3 rather, and these are the screws in 2. So now we look here, you can see we've jacked it out. We're in a little bit of lordosis. These are the screws on the left side. They look good. Now all our indices were great. Spinal cord monitoring was normal throughout, so we're good. So this should help this person greatly.